All right, we're here with 5 questions with EHR Vendor executives, and we're here with the Rohit Nayak, which I probably slaughtered his name, but he can correct me if I'm wrong. And he's the VP of Physician Tech Solutions at Quest Diagnostics. And the first question we have for him today is, what differentiates your EHR today?
Great. The name is Rohit Nayak.
Thank you.
So good to be here. Thanks for being here. What differentiates our solution? The way I look at it, there are 3 basic tenets for an EHR solutions. One I call accessibility, the second I call interoperability, and the third is the clinical aspects of the solution, the decision support that we provide. I believe that most solutions have entered the market over years, focused on automating the processes that happen within the office as opposed to looking at how to transact outside of the office, trying to achieve a paperless office, which means basically trying to remove all paper all paper charts and digitize them, and looking at automation from a standpoint of focusing on the encounter node so that you get the right level of billing so you can justify the investment in the EHR systems. That's how I believe systems have really come to be and have been defined. We looked at the market differently. We came at it from the standpoint of those 3 tenets that I just described. Our core values, given the fact that we are a part of Quest Diagnostics, is in driving clinical interoperability, also defined as clinical transaction capability between the provider and all the external entities that they transact with, from a lab standpoint, from a prescription standpoint, from a radiology standpoint, from a transcription management standpoint. So looking at all of those capabilities and trying to fill the chart, not necessarily from just a scanning perspective, but from a transactional perspective. So that's the first thing. Second is accessibility, which also can be defined as usability. So we looked at this and defined this as a specific solution for the small physician office. So it wasn't necessarily about automating every step like an ERP system or that one might implement, but it is about providing the flexibility for these small offices to do the things that they need to do, and allowing them to define it. Small offices, you have one person doing 10 tasks. So you just can't have the typical workflow system for automation. You want to provide that flexibility so that the process doesn't get ridiculous. The last piece is almost the most important. How do you use the information that's there in the office, in the EHR? And given our clinical background and some of the rules-based capabilities that we built in within the solution, we have enough clinical intelligence as a part of our solution that allows the physician to feel as if they have a solution that understands and presents information in the manner that they need to look at, and also derive intelligence and additional conclusions that they otherwise might not get at by just looking at a piece of paper. So those are the 3 tenets that we look at. We support as extensions. So we look at from a usability standpoint, does the solution support an iPad? Does it support an iPhone? And what we've seen is remarkable, and I'm sure you hear this elsewhere with other vendors as well, is the amount of adoption, self-motivated adoption by physicians and other caregivers to take to these solutions and use them in ways that we hadn't considered before. So we've certainly taken the leap or the jump in terms of supporting those types of solutions, and we think the combination of all of what I just described over here, puts us remarkably different than some of the big names that are here at the show.
Excellent. All right, the second question is, in what ways has the EHR stimulus money and meaningful use had an impact for good or bad on the EHR industry?
I think it's been fantastic because now we have the conversation. Right? We have the conversation of electronic health records. So no longer, all the surveys that we've done over the last, say, 10 years, right, of the physician audience said, when are you going to implement an EHR? Within the next 12 months, right? That's the standard answer. And we clearly know that hasn't happened, right? We believe that the stimulus, or I believe that the stimulus or the incentive plan and the amount of conversation that has created has removed the question of if. So now it's a question of when, right?
Sure.
And so that has been the incredible positive that has happened. The negatives, of course, nothing is perfect. The negatives are about some of the do's and don'ts of how you do that, some of the confusion associated with that. But I think the positives far outweigh the negatives out here. It is a tough time for providers to choose solutions. There's no question about it. It all sounds the same, they all sound great,
Right.
and the provider has to do their due diligence to choose the right solution, and it is a tough time for them.
Definitely. So what are the top reasons why doctors are adopting EHR software?
So the question was sort of generic, so it wasn't about our solution
Sure.
specifically,
Absolutely.
right? Okay. I do believe, and this, the incentives play a role, frankly, because
They do.
yeah. And so if provider A has heard about provider B down the hall saying, hey, he just got the $18,000 for doing so, it's, wait a minute, I should be doing that too, right? So I think the incentives are playing a fantastic catalyst, as it should, in terms of getting the initial interest and motivation going. I think the challenge for us and the industry at large is to make sure that ultimately when we deliver the solutions, we're doing it right. We're providing the value that is expected. We're setting the right expectations in terms of what the solution will do, and then ultimately providing the benefits that are supposed to be derived from such a solution to drive the utilization that we all want.
Sure. All right. And what are the main reasons doctors aren't adopting EHR software?
I mean, it's the other side of the coin, right? I mean, it's the confusion associated with that. They've heard the horror stories for the last 10 years. Many of these folks have actually bought a solution and stopped using them.
Right.
For all the reasons that I talked about earlier. So the industry, in that sense, has not done well for itself over the years, and I'm saying this over the long term. So we have, in a general sense, as an industry, a second chance now to do it right. We have the catalyst from the industry, from the government, and hopefully we can overcome these biases, these hurdles, and impressions that have been built over time.
Definitely. All right. And the last question is, what will differentiate your EHR 5 years from now?
I believe it's the number of people using it as a start. I mean, we're very, very bullish in terms of the progress that we've made in the short time that we've offered our solution. In terms of the clinical sophistication that we would offer through our solutions, we, as Quest Diagnostics, we work with a lot of EHR vendors, and so we know that we have to spend a lot of time educating them on the lab transaction workflows and to make sure that it gets the right way. So in a general sense, I mean, that is still a mountain that we all have to climb as an industry, and so we believe that we have an edge on that given our background and our industry. And then the last one that we know that we spend a lot of time and effort on, almost taking a risk in certain cases, is our focus on the small physician practice and how we've approached our solution definition, our implementation services, our accessibility, focused on that particular audience. So I believe we'll stand out for those reasons.
Excellent. Thank you.
Thanks.